Hi, friends. Today I've prepared a very useful topic for you. This routine test raises stroke risk overnight. Senior health tips. Let's go. Each year, countless older Americans dutifully attend their annual physicals, confident they are taking the proper steps to safeguard their health. But what if some of the most standard procedures on that checkup list could inadvertently elevate your chances of a cerebrovascular event, seemingly out of nowhere? It's a notion that feels counterintuitive. You place your faith in your medical team, adhering to their guidance. Yet, concealed within the complex protocols of contemporary medicine are latent dangers that are seldom discussed, not on the evening news, not in the pamphlets at the doctor's office, and occasionally not even by your physician. Picture this. You leave your yearly exam feeling reassured, only to be struck by a sudden bout of dizziness, vision disturbances, or something far more grave just a few days later, leaving you to question what went wrong. The unvarnished truth is that specific diagnostic procedures, particularly when performed with high frequency or on individuals with certain underlying health issues, can silently provoke abrupt surges in blood pressure, interfere with cerebral blood flow, and initiate a cascade of events that culminates in a stroke. However, the purpose of this discussion is not to instill fear, but to empower you with knowledge. It's to help you formulate better questions and to advocate for the well-being of yourself and your family, because once you are over 60, proactive health care isn't solely about early detection. It's also about sidestepping iatrogenic problems, those we might unintentionally create. In the moments ahead, we will delve into 5 prevalent medical tests that can harbor undisclosed stroke risks, especially for the senior population. Most importantly, you will discover precise strategies to protect yourself before you even step into your next medical appointment. Let's begin with a procedure you should approach with informed caution: the computed tomography. CT scan administered with a contrast agent. If you've undergone this test, you likely recall that distinct sensation of warmth spreading through your veins. This is the contrast medium at work, designed to enhance the visibility of your blood vessels, organs, and other tissues for your radiologist. It sounds beneficial, and it often is, but a critical piece of information many seniors don't receive is that this simple injection can do far more than just clarify diagnostic images. It has the potential to place quiet, yet significant, strain on your cardiovascular system, a risk that is magnified if you are over 60 and managing conditions like hypertension, cardiac disease, or renal insufficiency. Emerging data from 2023 continues to underscore the importance of assessing renal function before administering these agents, as even mild, undiagnosed kidney issues can increase complication rates for a subset of individuals. The contrast material can provoke what's known as a hypertensive reaction, causing a precipitous fall in both heart rate and blood pressure. This can manifest as lightheadedness, queasiness, or even a brief loss of consciousness. In other instances, the physiological response is the exact opposite. Blood pressure can climb sharply, causing fragile blood vessels to constrict or spasm. When this occurs, the likelihood of a stroke or another major cardiac event quietly increases. A pivotal study published in the Journal of Neurovascular Medicine revealed that older adults who received contrast-enhanced CT imaging showed a markedly higher incidence of vascular complications within a 72-hour window, a risk most pronounced in those with a documented history of high blood pressure, heart disease, or compromised kidney function. In essence, the more fragile your system, the greater the potential danger from the contrast agent. Consider the case of a 78-year-old woman who underwent a standard abdominal CT scan for persistent digestive pain. The results were unremarkable, and she returned home. 48 hours later, she experienced a minor stroke. The probable trigger was the contrast medium, which likely caused a temporary, intense spike in her blood pressure, dislodging a small plaque or promoting a clot that obstructed blood flow to a region of her brain. This is not to say that CT scans with contrast are inherently bad. They are invaluable for detecting cancers, aneurysms, and embolisms. The crucial takeaway is that their use must be judicious, not merely a just-in-case part of a routine examination. To safeguard yourself, before consenting to a CT with contrast, ask your doctor, is this imaging absolutely necessary for my diagnosis? Or could a safer alternative, like a non-contrast scan or an MRI, suffice for someone with my health profile? Disclose your complete medical history, emphasizing any issues with blood pressure, kidneys, heart, or previous adverse reactions to contrast materials. Next, we turn to the cardiac stress test, often referred to as an exercise tolerance test. Conceptually, it appears to be a prudent diagnostic tool. Connect to a heart monitor, begin walking on a treadmill, and observe the heart's response to physical exertion. Yet, for an individual over the age of 60, particularly one with hypertension or known cardiac issues, this seemingly straightforward evaluation can become a high-stakes event. The mechanism of risk is simple. As the test progresses, you are prompted to increase your pace. This exertion causes your heart rate to accelerate and your blood pressure to climb, placing your entire cardiovascular system under sudden and intense demand. While a healthy person in their 30s might handle this without issue, for a senior, especially one with pre-existing vascular fragility, it can be akin to fanning a flame near a tinderbox, potentially setting off severe complications. These risks include perilous spikes in blood pressure, the onset of dangerous arrhythmias, irregular heartbeats, and, in uncommon but documented instances, microtears in delicate blood vessels, including those in the brain. A 2020 analysis in the Journal of the American Heart Association examined over 1,300 patients older than 65 who were subjected to treadmill stress tests. The findings were sobering. Nearly 7% encountered adverse events during or immediately after the test, such as extreme blood pressure surges and abnormal cardiac rhythms. The demographic most affected was, unsurprisingly, those with pre-existing vascular conditions. This is not merely theoretical. Consider the experience of Eleanor, a 75-year-old from Florida with a long-standing history of managed high blood pressure. Her physician suggested a routine stress test. Partway through the evaluation, She reported feeling intensely dizzy with a constricting sensation in her chest. The test was halted immediately the following day. She suffered what was diagnosed as a transient ischemic attack or a mini-stroke. Her doctors theorized that the abrupt rise in blood pressure during the test likely ruptured a minuscule, fragile vessel in her brain. To be clear, the test was not the direct cause of the stroke, but it introduced a significant stressor to an already vulnerable system, tipping the scales. The lesson here is to engage in a detailed conversation with your physician. Ask, is there a less strenuous method to assess my cardiac health? Often, a pharmacological stress test, which uses medication to mimic the effects of exercise, or a simple resting echocardiogram can provide valuable information more safely for older adults. If you are asymptomatic, meaning you have no chest pain, shortness of breath, or unusual fatigue, question whether the test is genuinely required at this moment. Let's now address a procedure that has become exceedingly common for those over 60, the endoscopy. Whether it's to examine the esophagus, stomach, or colon in a colonoscopy, physicians frequently recommend it as a precautionary measure, while sometimes justified. It's crucial to understand what is often left unsaid. If the procedure is not strictly necessary and involves sedation, it could introduce more risk than benefit. To start, a vast number of adults over 60 are on medications that affect blood coagulation, such as warfarin, Eliquis, or daily low-dose aspirin. During a sedated endoscopic procedure, your blood pressure and circulatory dynamics naturally shift. When you combine this physiological change with medications that inhibit your blood's clotting ability, you create an environment where the risk of internal bleeding or, more alarmingly, cerebral circulation issues that could precipitate a silent stroke is elevated. A large-scale 2021 review published in the American Journal of Gastroenterology found that among patients over 65 who underwent endoscopic procedures with sedation, there was a statistically significant uptick in transient ischemic attacks, tears, or mini-strokes within the subsequent 72 hours. While these were not catastrophic strokes, they served as critical warning signals of compromised blood flow to the brain. One compelling case involved a 79-year-old man who had a routine screening colonoscopy with sedation. He had been feeling perfectly fine. 2 days post-procedure, he began experiencing slurred speech and a loss of coordination. An emergency room evaluation confirmed he had suffered a mild stroke. His medical team concluded that the drop in blood pressure during sedation, coupled with his daily aspirin regimen, likely created the perfect storm for a small clot to become dislodged and travel to his brain, even when the procedure itself is mechanically low risk. The confluence of sedation, advanced age, and certain medications can be a dangerous cocktail. This doesn't imply that all endoscopies should be refused. It means you should not consent to one without a clear, compelling reason from your doctor. If the recommendation is based solely on a time interval since your last screening and you have no symptoms, ask about less invasive monitoring options. Always provide a complete list of your medications and ask pointedly, will I need to pause my blood thinner for this? What are the specific risks of sedation for a person of my age and health status. If you are apprehensive about sedation, inquire if the procedure can be performed without it or with a lighter form of anesthetic. Now, let's explore a diagnostic tool that frequently operates without raising alarm bells, yet involves an organ many of us overlook in this context: the kidneys. Magnetic resonance imaging (MRIs) are remarkable technologies, allowing physicians to peer deep inside the body, identify nascent problems, and often prevent the need for invasive surgery. However, the introduction of a contrast agent typically used to generate sharper, more detailed images necessitates a high degree of caution, particularly for older adults and anyone with even minor renal compromise. The contrast media used in MR frequently contains gadolinium, a heavy metal. In a healthy individual, this substance is designed to be efficiently filtered and expelled by the kidneys. The issue is that after the age of 60, renal function naturally begins to decline. If you have undiagnosed chronic kidney disease or even moderately reduced function, your body may struggle to eliminate the gadolinium effectively. Over time, trace amounts of this heavy metal can be retained in the body. This retention is not benign. It has been conclusively linked to a rare but devastating condition known as nephrogenic systemic fibrosis (NSF), which leads to the hardening and thickening of the skin and connective tissues. In severe cases, NSF can severely restrict movement, impair breathing, and cause organ failure. But there's another, more subtle risk that is gaining attention in the medical community. Retained gadolinium has been identified in brain tissue, and emerging research, including a 2023 analysis in neuroradiology, is investigating its potential link to subtle neurological symptoms like confusion, brain fog, and disorientation, especially in individuals already at risk for circulatory problems. A landmark study in the journal Radiology back in 2019 tracked over 2,000 patients older than 65 who had received contrast-enhanced MRIs. Within 1 week of the procedure, approximately 5% reported stroke-like symptoms such as headaches, blurred vision, and balance issues. These were not full-blown strokes, but they were significant red flags. A common denominator among most of these patients was underlying kidney impairment, whether it had been previously diagnosed or not. Consider Robert, an 80-year-old from Texas who had an MRI for persistent back pain. His doctor ordered it with contrast for a more thorough evaluation. Robert was unaware that his kidney function was diminished. In the days following the scan, he felt unusually lightheaded, weak, and mentally foggy, symptoms that persisted for nearly a week. It was only after his primary care physician ordered blood work that they discovered he had stage 3 chronic kidney disease. His story underscores a critical communication gap. If your doctor suggests an MRI with contrast, ask if a non-contrast study would be sufficient. If the contrast is deemed essential, insist on a kidney function test beforehand. A simple blood test to check your estimated glomerular filtration rate (eGFR) can provide crucial information and peace of mind. Finally, let's direct our attention to a test that is often presented as a smart, routine screening but may be funneling. older adults toward high-risk surgeries they might not actually require. The carotid artery ultrasound. This test is entirely non-invasive, takes only a few minutes, and involves no radiation, needles, or contrast dyes. It seems like an ideal preventive measure. However, a critical fact that many people over 60 are not told is that if you are asymptomatic, ordering this scan as a fishing expedition might set you on a path to an unnecessary and risky surgical intervention. The carotid arteries are the primary conduits supplying blood to your brain. With age, it's normal for these vessels to develop some degree of plaque, small buildups of cholesterol and calcium. This is a natural part of the aging process, but not every plaque deposit requires surgical removal. In many instances, managing it with medication and lifestyle changes is far safer than operating. Here is how the situation can escalate. You have the ultrasound, and it reveals a degree of stenosis or narrowing in the artery, perhaps 50% or even 60%. This number sounds alarming. Your doctor then refers you to a vascular surgeon, and you are suddenly in a consultation discussing procedures like a carotid endarterectomy, surgically removing the plaque or stenting. Yet, if you had no preceding symptoms, no spells of dizziness, no transient vision loss, no weakness, these interventions might offer negligible benefits while carrying substantial risks. A landmark study published in the Journal of the American Medical Association (JAMA) followed over 3,000 seniors who had moderate carotid narrowing but were asymptomatic. The researchers discovered that for many of these patients, surgery did not lower their stroke risk any more significantly than optimal medical therapy and lifestyle modifications. More disturbingly, a small but significant percentage of patients who underwent the surgery actually suffered strokes as a direct complication of the procedure itself, either during the operation or in the immediate recovery period. The story of Dorothy, an 81-year-old from California, is a poignant example. During a routine checkup, feeling perfectly well, she was sent for a carotid ultrasound just to be thorough. It showed a 65% blockage. Within weeks, she was scheduled for surgery. Tragically, she suffered a small stroke during the procedure. She survived, but now contends with residual weakness on her right side. Her experience highlights a crucial question. Was the intervention truly worth the risk? If your doctor recommends a carotid ultrasound and you are symptom-free, ask, what are we specifically looking for? And how will the results of this scan alter my current treatment plan? Understand whether this scan is more likely to provide actionable information or simply generate anxiety. If you are already effectively managing your blood pressure and cholesterol and maintaining a healthy lifestyle, additional tests may not change your path. If a scan has already shown some narrowing, don't rush to a surgical decision. Inquire about periodic monitoring and always seek a second opinion before agreeing to any invasive vascular procedure. Let's conclude with a gentle reminder that you are the most important guardian of your own health. The central message is this: not every test is inherently dangerous, but not every test is unequivocally necessary, especially as we age. Our bodies respond differently in our later years. What is considered routine a dose of contrast dye? A round of sedation, a screening scan can create unforeseen ripple effects. A simple injection could cause your blood pressure to surge. A quick screening could lead to a cascade of unnecessary and risky interventions. This is why it is absolutely vital to pause, to ask clarifying questions, and to ensure that every medical procedure is tailored to your specific health needs, not just a standardized protocol. You have the undeniable right to use your voice, to ask, "Is this truly essential for my care right now?" And to inquire, "Can we explore a safer alternative?" Informed decisions are the bedrock of positive health outcomes and peace of mind. Your health journey is unique, and your voice is a powerful tool in shaping it. If this information has empowered you, please consider liking this video and subscribing to our channel for more insights that put your health first.